family history and their stress levels and their cholesterol and their blood pressure, they have 10% chance of dying of a heart attack in the next 10 years. So therefore take the tablets and the blood pressure, the cholesterol. And I mean, they come with that mindset of fear and disease. And now you're sort of showing them how from their own common sense they can make changes in their life that they know is going to make a difference, except you as a professional are telling them this is making an awful lot more difference than you realize. You've got to do it. So the next thing is just to motivate them and to get their intellect completely committed to the changes that you have to make, that they have to make. And you negotiate that with them. What are they prepared to do? Because even if you get them started, you know that the very beginnings of integration and balance in their mind-body will start to get them thinking more clearly, and the next time you can get them to do more. But it's very interesting as well that you're also working on the level of feeling with their emotion. Because, and most often I see this now with a middle-aged lady. And you just say something very simple like, you know, you have to learn to love yourself. And then there's a profound silence, because you have to let that sink in. And often there are tears as that's processed. Because the reality for them has been all their life. They've been devoted to their children, devoted to their husband, and perhaps working as well. And sometimes you try and lighten the mood, and you ask them, you know, how they think of that, and then you point out to them that they wouldn't do that to their children. You know, that if the children were tired, they go to bed. If the children were hungry, wouldn't you say, would you feed them? And then I sometimes say, you know, if you did to anybody else, if you did to your children what you do to your own body, you'd have yourself up for abuse. You have to judge who has a sense of humor and who can run that. But you also have to be careful, because you have very impatience, people with cancer, and you can't have them going out the door saying, oh my God, I did this willfully, I ate wrong, I had a bad routine, look what I've done to myself. So you have to then bring back the holistic context of pointing out how we are all in this society, this collective, and our whole orientation up to this point had been to look out, and we lost touch with that innate being in awareness. So you're bringing to their awareness that whole pratyapara and the need for them to reconnect at a very profound level with that innate being who is structuring their physiology, and begin to recognize. They came in the door. Often I will say before I start, you know everything I'm going to tell you. You know what you should be doing. But you have to hear me telling you before you're going to do it. And so it's a recognition, because the knowledge is already there. The Vedas and the physiology. And the whole of Maharishi's program is that self-referring process, but most profoundly with the self. And that you can bring out then to the patient in that context. So you can see how the Maharishi AyurVeda context gives the physician so much more that he can bring to the patient to awaken within the patient that amazing wisdom that they already have, and to motivate them to get back on track and get back in tune. And so there's so many other aspects of Maharishi AyurVeda that the practitioner can bring to bear according to the needs of the patient. And what is, I think, so fascinating though, is that again, when this concept and paradigm of putting the patient to the center and providing for that patient all the patient needs for health, where Maharishi in his wisdom decades before, bringing that whole concept to fulfillment when you get to the center of the patient through Maharishi AyurVeda, through their consciousness awakening. And that's the ultimate of patient-centered care, and that's what Maharishi AyurVeda is bringing, patient-centered care. And This is such a powerful paradigm. We can use it to our advantage. Because ultimately, if patients out there knew what is here within this room, the knowledge you have this weekend, they would be so demanding of it. We've got to get this knowledge out there, because the way we're going to move the politicians and the administrators and even those healthcare practitioners who are established in old paradigms, the way we're going to get them is through their patients. So the most fundamental thing anyone in this room could do for anybody else is awaken them to that innate being of their own consciousness and teach them to know. And the second most important thing anybody in the room could do for anybody they love, anybody they care about, anybody they know, is to give them what you know about Maharishi AyurVeda. It's a blessing to them. And as you do, you're doing the work of Dhanvantari, and you're doing the work of Maharishi. You're repaying him in very small measure for the immense wealth you've got from him. So, thank you.